These are some various sections through the brain. For orientation, this is the anterior aspect, and this is the posterior aspect. And here on the first section, we have the fat surrounding the skull. This is the bone of the skull. It's composed of the external table, the diploe, and then the internal table. Here we have the two cerebral hemispheres. This is the gray matter on the outside, and this is the white matter. They are separate from each other by the median longitudinal fissure that's occupied by the falx cerebri. This is the superior sagittal sinus. These two are for the superior sagittal sinus. And this is the central sulcus. And these nerves will be visible in the next section. So this is section 1. Section 2, some features are again repeated. The gray matter, the white matter, the skull, the fat. Here we see the temporalis muscle. This is the temporalis muscle. And now we see the beginning of the corona radiata. This is the corona radiata. And again the superior sagittal sinus. Maybe we can say these are the supratrochlear nerve, the supratrochlear artery, supratrochlear vein, supratrochlear vein, and then the supraorbital vein, nerve. Supraorbital vein. This is the supratrochlear vein, and this is the supraorbital nerve. This is all about section 2. Now section 3. Again, we see the temporalis muscle, and next to it we see this is the auriculotemporal nerve, this red structure. This is the auriculotemporal nerve, and we see the superficial temporal artery and superficial temporal vein. Okay, maybe this nerve is the posterior auricular, not sure. Now for the brain, we see this is the body of the lateral ventricle. This is the lateral ventricle. This is the right side and the left side. We see the body, and this is the genu of the corpus callosum. This is the genu of the corpus callosum. This is the splenium of the corpus callosum. The fibers spreading from the genu to the frontal lobe form the forceps minor. So these are the forceps. This is the forceps minor, and the fibers spreading from the splenium form the forceps major. This is forceps major. And we have a choroid plexus within the body of the lateral ventricle. So any spot within the structure is to be said the choroid plexus, and mention the sides. So this is the choroid plexus of the body of the lateral ventricle. And in between we have the septum pellucidum. This is the septum pellucidum. And again, this is the falx cerebri, the superior sagittal sinus, and the inferior sagittal sinus. Now, section 4, we see the frontal sinus. Section 4, first we see the frontal sinus. Again, the temporalis muscle. We see, here, so this is the body of the lateral ventricle. So next to it is the body of the caudate nucleus. And now here, we see the frontal horn, or the anterior horn of the lateral ventricle. This is the anterior horn of the lateral ventricle, and this is the posterior horn of the lateral ventricle. This is the choroid plexus within the posterior horn of the lateral ventricle. And here we again see the septum pellucidum. Now this is the head of the caudate nucleus. And this is the tail of the caudate nucleus. On this side, head, tail of caudate nucleus. And lateral to the caudate nucleus, we see the internal capsule. The internal capsule that separates the anterior limb. We have the anterior limb, and then the genu, the anterior limb, the genu, and then the posterior limb of the internal capsule. The anterior limb separates the head of the caudate nucleus from the lentiform nucleus, and the posterior limb of the caudate nucleus of the internal capsule separates the thalamus from the lentiform nucleus. These are the two thalami. This is the thalamus, and between them is the third ventricle. This is the third ventricle, a slit-like structure. So again, internal capsule, and lateral to it we have the lentiform nucleus. This latter area, the more medial one, is the globus pallidus. And the darker area, the more lateral one, is the putamen. Lateral to the lentiform nucleus, we have the external capsule. This is the external capsule. And lateral to that, we have the claustrum. Lateral to the claustrum, we may see this is the extreme capsule, and then the insular region. This is the insula, or just white matter of the insula, and this is the gray matter of the insula. We see these two are the thalami, and here we see this structure is the column of the fornix. This is the fornix. I believe it's the anterior column of the fornix, and here we have the posterior formation of the posterior column of the fornix. These two are forming the posterior column of the fornix. And again, superior sagittal sinus, inferior sagittal sinus. Fifth section, again we see a wider aspect of the frontal sinus, the frontal air sinus. And again we see the superior sagittal sinus, temporalis muscle, with its nerves and blood vessels. We see some new structure. This is the frontal belly of the occipitofrontalis muscle, or just frontalis muscle. Now for the brain, we see this is the head of the caudate nucleus again. Head of the caudate nucleus. This is the head of the caudate nucleus. This is the internal capsule again. The lentiform nucleus, the light area is the globus pallidus. This one is putamen. External capsule, the white structure. Claustrum, extreme capsule, insula. We said this is the head of the caudate nucleus. This is the tail of the caudate nucleus. This is the inferior horn of the lateral ventricle. And within it, again, we see the choroid plexus. So this is choroid plexus of inferior horn of lateral ventricle. And you see these are, maybe they're called the thalamus, maybe the hypothalamus, so it's better to say the densiphalum or the thalami. Between them we had the third ventricle. And here we have the optic radiation formed by the internal capsule. These two are the optic radiation. This is the inferior sagittal sinus again. Inferior sagittal sinus. This is still the fornix, I believe. And I don't know. This is the fornix, and so now this is the posterior column maybe, or the crura, and then this is the anterior column. Not so sure. So both of them are fornix. That was important. And so done. This section. Now we see the globes of the orbital cavity for the eyeball. We see this the lateral rectus muscle. This is the medial rectus, and this is the superior rectus. Only the lateral rectus is supplied by the abducens nerve, and these two are supplied by the oculomotor nerves. And again, we see the temporalis muscle, the frontal belly of the occipitofrontalis, and for the brain, you can see this is. You can make this a landmark for yourself. This is the optic chiasm. This one is the optic chiasm. Emerging from it is the optic nerve. So this is the optic nerve, optic chiasm, and making it is the optic tract. This is the optic tract, optic chiasm, optic nerve. Okay. And behind the optic chiasm, we have the infundibulum, or the stalk of the pituitary gland. This is the infundibulum. And behind it, we have the mammillary bodies. These two are the mammillary bodies. And here, these two openings, the opening itself is internal carotid artery. That opening is the internal carotid artery. Same here. Internal carotid artery gives off two branches. This is the anterior cerebral artery, branch of the internal carotid artery, and this is the middle cerebral artery, the other branch of the cerebral artery. And then we have the midbrain. This is the midbrain. The midbrain is divided by the cerebral aqueduct of Sylvius. This is the cerebral aqueduct into the cerebral peduncle. Anteriorly, it is called the cerebral peduncle, and posteriorly, you have the tectum. This small area is the tectum. And the cerebral peduncle is further divided by the substantia nigra. This is the substantia nigra into crus cerebri. This is crus cerebri, and the tegmentum. This is tegmentum. These two small structures are the red nucleus. Here we see the parahippocampus, the hippocampus. This is the hippocampus or hippocampus, and this is the remaining of the inferior horn of the lateral ventricle and the choroid plexus. We see the superior vermis, the vermis. So as the vermis or the cerebellum appears, the inferior sagittal sinus converts into straight sinus. It receives the great cerebral vein and then becomes straight sinus. This is still superior sagittal sinus, but this is straight sinus. And these gray areas are the amygdala or the amygdaloid bodies. And next section. So here we have these two are the remaining of the frontal sinuses. And now here we see the nasal cavity. These two are the nasal cavities. The nasal cavity itself. Separating them is the nasal septum. This is the nasal septum. Nasal cavity. These are the ethmoidal air cells. The anterior, middle, and posterior ethmoidal air cells. This is the sphenoid sinus. The sphenoid sinus. Behind it, we have the pituitary gland itself in the sella sacca. So this is pituitary gland, and behind it we have the dorsum celli. This is the dorsum celli. On the sides of the pituitary gland, we have the cavernous sinus. The region is the cavernous sinus. Passing through the cavernous sinus are the internal carotid artery, and the abducens nerve. This structure is the abducens nerve. And here we have the pontine fossa. It's related to the pons, in front of the pons. This is the pontine fossa. And here we have the basilar artery. This is the basilar artery. This is the pons. Going through it is the cerebral aqueduct. And here we have the cerebellum. Surrounding it is the tentorium cerebelli. This is the tentorium cerebelli. And again we have the straight sinus and the superior sagittal sinus. This is the lens, and the orbital cavity. Maybe this is still the medial rectus and the lateral rectus. This is the optic nerve. So this is the temporalis. So this is still the temporal lobe of the brain, of the cerebrum, temporal lobe. The orbital cavity. This is the inferior. I guess this is the inferior rectus. Maybe this is the inferior rectus. Maybe this inferior oblique. Okay. Again, we have the nasal cavity, the nasal septum, the ethmoidal air cells, the sphenoid sinus. Again, this is the internal carotid artery. Here, the basilar artery, and the cavernous sinus, of course. And we see the trigeminal nerve. This is the trigeminal nerve, emerging from the lateral aspect of the pons, and this is the ophthalmic division of the trigeminal nerve. Okay. Again, so this is pons. Behind it, this is the fourth ventricle. The fourth ventricle of the ventricular system of the brain. And behind the fourth ventricle, we have the cerebellum. This is the cerebellum. And now, see, this was superior sagittal sinus. Now drains back into the confluence of the sinuses. This is the confluence of the sinuses. Okay, and this bony projection is the internal occipital protuberance. from the confluence of the sinuses, emerging are the two transverse sinuses. This is the right and this is the left transverse sinus, and then become the sigmoid sinus. So this is the formation of the sigmoid sinus. So I guess this is temporalis or masseter. We will see in the next section. And yeah, that's it. Next section. Now we see some new features, which is mainly the maxillary air sinus. The maxillary air sinus. You see the nasal cavity, nasal septum again, the sphenoid air sinus. Now this is the masseter, the temporalis. That's what's shown. Now this is the uncus of the temporal lobe, uncus. So the internal carotid artery, the cavernous sinus. This is the maxillary division of the trigeminal nerve. In the previous section, we saw the ophthalmic division. Now we see the maxillary division. And in the next section, you see the mandibular division. So, maxillary division of the ophthalmic nerve, maxillary division of the trigeminal. This nerve is you can say vestibulocochlear or facial. Okay, these are the maxillary air sinuses, not important. And here, this is the formation of the medulla oblongata, still the basilar artery, medulla oblongata, and this is the fourth ventricle, the cerebellum. This nucleus, these two nuclei are the dentate nucleus of the cerebellum. This is the sigmoid sinus, and this is the occipital sinus. This goes up to the confluence of the sinuses. So this is the internal occipital protuberance. And I believe it's done. Here again, just the muscles. These are not important. Again, maxillary air sinus, nasal cavity, nasal septum, sphenoid sinus, and this is the temporalis. The masseter, temporalis. This is lateral pterygoid muscle. Lateral pterygoid goes to the temporomandibular joint. This is the temporomandibular joint. This nerve is the mandibular branch of the trigeminal nerve. Previous section, we saw the maxillary division. Now this is the mandibular division of the trigeminal nerve. This is the internal carotid artery. Internal carotid artery coming up from the carotid canal. Here, this is the external acoustic meatus, or external auditory canal. This is the tympanic membrane. The tympanic membrane, and this is the basilar artery still, the sigmoid sinus, the cerebellum. This is the medulla oblongata. It's about to become the spinal cord. Now, here, this muscle is new. This is the occipital belly of the occipitofrontalis muscle. Occipital belly of the occipitofrontalis muscle, and this bony projection is the external occipital protuberance. This is internal, and this one is external occipital protuberance. This suture is the lambdoid suture. It's not important. Lambdoid suture. And yeah, next section. This is the last section, i.e. the 11th section. Again, nasal cavity, nasal septum. Here we have the end of the maxillary air sinus, and here we see the masseter muscle, temporalis muscle, lateral pterygoid, internal carotid artery. Now the sigmoid sinus and the inferior petrosal have formed the internal jugular vein. We are at the side of the jugular foramen. This is the internal jugular vein. This nerve is the hypoglossal nerve, and this bone is the first bone of the vertebral column, the atlas. So this is now the spinal cord. This is the anterior aspect, so this is anterior median fissure, and this is the posterior median sulcus, and this is no longer the cerebral aqueduct, it is the central canal. Maybe this is the vertebral artery. Vertebral artery, or maybe anterior spinal, but mainly vertebral artery. We said this is the hypoglossal nerve, cerebellum, and That's it.